Today's webinar was developed to complement our first Healthy People e-learning lesson, which focuses on San Diego's Childhood Obesity Initiative and how to define and measure success in a systems approach. To build on that topic, today's webinar brings both experts and communities together to problem solve around how we can implement and evaluate policy and environmental changes that work to reduce childhood obesity. Next slide. Healthy People e-learning lessons and activities, like the one today, are designed to help communities learn how to reach the nation's health goals as outlined by Healthy People 2020. Lessons and activities feature case studies of communities working to reach Healthy People 2020 leading health indicator objectives and are designed to take participants beyond the data to explore the challenges, successes, and processes involved in creating and sustaining healthier communities. Next slide. The Office of Disease Prevention and Health Promotion partners with the Centers for Disease Control and Prevention to offer free continuing education for Healthy People e-learning activities. After this webinar, you will be eligible to obtain the following types of continuing education: continuing medical education, continuing education contact hours and health education, and continuing education units. You will need to complete a brief post-test and evaluation to receive your continuing education or certificate of completion. For directions on how to obtain continuing education for this activity, visit Healthy People e-learning under the Learn tab at healthypeople.gov. For today's webinar, we are delighted to be joined by a diverse group of panelists from the Centers for Disease Control and Prevention, the Health Resources and Services Administration's Healthy Weight Collaborative, as well as two HRSA Healthy Weight Collaborative communities, San Diego, California, and Sarasota, Florida. All of our panelists will be on the line and ready to participate in today's Q&A. We will also be joined by Dr. Shika Anand, Director of Obesity Strategic Operations for the National Initiative for Children's Healthcare Quality, which worked with HRSA to implement the Healthy Weight Collaborative project. Next slide. During today's webinar, you will learn about Healthy People and the Healthy People 2020 Leading Health Indicator topic on nutrition, physical activity, and obesity, resources and indicators of policy and environmental change and obesity and prevention, HRSA's Healthy Weight Collaborative, the challenges and opportunities communities face when measuring policy and environmental change, and how individual strategies can be linked to and scaled with larger population-level policy and environmental strategies. Next slide. So what is Healthy People? Often called a roadmap for nationwide health promotion and disease prevention efforts, Healthy People is about understanding where we are now and taking informed action to get where we want to go over a 10-year period. It often provides science-based objectives for improving the health of our nation, engages a network of multidisciplinary, multi-sectoral stakeholders at all levels, creates a comprehensive strategic framework for health promotion and disease prevention issues, and includes specific measurable objectives with targets to be achieved by the year 2020. Healthy People calls for the tracking of data-driven measures and outcomes that monitor our progress over time, allowing us to see trends and to motivate, inform, and focus action. Next slide. Healthy People is used in many ways by health officials at the national, state, or local levels, national membership organizations, businesses, health professionals, and researchers. Consider Healthy People as a menu from which you can choose a la carte items for your needs. It is used as a data tool for measuring program performance, a framework for program planning and development, a goal-setting and agenda-building platform, a foundation for teaching public health courses, benchmarks for comparing state and local data, a national agenda for forging partnerships, and a model for other countries. For more information on Healthy People, visit the About section on healthypeople.gov. Next slide, please. Healthy People 2020 includes a set of leading health indicators. The leading health indicators, otherwise known as the LHIs, represent critical health issues that, if addressed appropriately, will dramatically reduce the leading causes of preventable deaths and illnesses. These indicators, or critical health issues, are linked to specific healthy people objectives. The LHIs have been selected to communicate high-priority health issues to the public, along with actions that can be taken to address them, with the overall goal of improving the health of our entire population. One of the LHIs is nutrition, physical activity, and obesity. Next slide, please. In today's webinar, we will focus on policy and environmental strategies that are working to address the leading health indicators specific to children, which are highlighted here and include the Nutrition Weight Status Objective 10.4, children and adolescents who are considered obese, and the Nutrition Weight Status Objective 15.1, total vegetable intake for persons aged 2 years and older.